Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. And as a practicing chiropractor, this particular study totally rings true, and it deals with something I deal with all the time. And it has to do with movement, and specifically fear of movement, which, believe it or not, there's actually a word for that. Kinesiophobia. Get that right. It's easier to spell than it is to say. But this fear of moving and how much it plays a role in perpetuating injuries. One of the biggest things I have with chronic pain patients is that they're afraid to move. You see this a lot, especially with knee pain. Even though we know that continuing to move with people who have knee arthritis, they will do better in the long run. There's almost nothing they will do, be reasonable, nothing reasonable they're going to do that is going to make things worse in the long run. And most often, movement will make it better. It's the biggest conversation I always have. We need to move. We are designed to move as a structure, as a human being. We're supposed to be moving. And so in this particular study, it's a small study, 102 people, and they looked at those that were exercising and those that were not exercising had to do with workplace injuries. And these people generally had mild to moderate pain. And what they found was that the ones that were exercising had a lower risk of recurrent, and let me be clear, mild to moderate low back pain. So we're talking about low back pain. Those who were moving had a lower risk of recurrence of the low back pain. They had less disability, and they had no work-related kinesiophobia. So they weren't afraid to be working and doing their job. And it all boiled down to whether or not they were moving and exercising or not. Now, the study didn't go into specifically what they were doing as far as exercising. I've certainly put out more than enough of what I think is appropriate, both from a short burst aerobic standpoint and from a strength standpoint. We need to be doing both. Sports, things that allow unexpected movements, things like racquetball, tennis, hiking, martial arts, jiu-jitsu, things like that, soccer, as opposed to like treadmill or elliptical, which are pretty predictable. I do think that those types of activities that require your body to constantly be moving will be better for low back pain. But the bottom line is we need to move. And if you're injured, and worse yet, if you're seeing a provider who tells you that you need to sit on the couch and not move, you need to find a new one, period. No questions, no doubts. Certainly they can work with you, maybe give some limitations, but to say you shouldn't be moving is one of the worst sets of advice that you can give. And as in my office, it is a very rare scenario that I would tell somebody to not move. Usually we may do grading if somebody's had a big injury, but in general, I'm not going to restrict anybody from movements. I let pain be their guide. As always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.